Good morning, ma'am. I'm Matthew Jacob and Sebastian, your student nurse for the day. So first, may I know your name, ma'am?
Yes.
Okay, what's your name, ma'am?
Cassandra Mary.
Okay, thank you. Your birthday, ma'am?
Baby 20.
And your age, ma'am?
10.
Okay, thank you. So for today, ma'am, we will do the bed bathing procedure. And then I will now close the curtains and close the doors for your privacy, ma'am. So next, after you provide the privacy to the patient, you will now gather all the equipments that we will be using. And then next is put a blanket to a patient so that we can remove the patient's hospital clothes and also provide a much more privacy for the patient. So next procedure, after we put a blanket to a patient, we can now remove the patient's hospital clothes. Ma'am, alisin lang po natin yung hospital clothes niyo, ma'am, para may start po natin yung procedure. Maintain the privacy while removing the patient's clothes. After we remove the patient's clothes, we will now put this in sa tamang lagayan niyo po, sa lalagyan po ng linen trash or linen bags. So next, I will now perform my hand hygiene. And put on my gloves. Hand hygiene is very important to reduce the spread of microorganisms in our body. And next, I will prepare the water with soap for our patients. Okay, we will now put a soap to the water. Exact amount only. Okay, and then next. And then next is we will get a waterproof blanket or the bed bath blanket. First is we will wash the patient's face. Okay, so we will put this rubber blanket or the waterproof blanket in the patient's head. Okay, ma'am, lagyan lang po natin yung rubber blanket para hindi po mabasa yung inyong punan. Okay, ma'am. After we put the rubber blanket in the patient's head, we will now put a towel in his eyes. Ma'am, lagyan lang po natin ang towel yung mata nyo. Edit ko yun ito. So next, is we will get a clean towel to dab in the patient's face. And then we will do this procedure in our hands so that there is no open area. Like this. We will do this in our towel. And then tap in the patient's face. Pat in the patient's face. After we did this, we will now pat the patient's face with the dry towel, so the face and the soap will rinse out. Okay. After that, we will remove the rubber towel in the patient's head slowly, and then position the patient's head into a comfortable position. Next is we will proceed now to the patient's hands, full hands. So we will expose only the right hand of the patient. And then put again the rubber towel under the patient's hand. After putting the rubber towel in the patient's hand, we will dab this again to the water mixture with soap. So after that, we will do again yung sa kamay po. Ganyan. And then yung kabila. and then this one, para maging ganyan po siya. And then repeat the procedure again. Pat the hands. And then, yung baba po ng kamay niya. And also her armpit. And then next po is wash the patient's hand in the soap mixture, water soap mixture, by putting it in the sa ano po lalagyan ng soap and water. So after we did that, we will get again a dry towel to rinse off the water in the patient's or the client's hands. Tap lang po para matuyo ito. Okay. When we are done in the patient's arm, we will remove the rubber clothes, and then our next step or next procedure is cleaning the patient's chest to abdomen. So we will wet again the towel. After we wet the towel is make again the proper hand towel procedure. And then we will now start cleaning the patient's chest to abdomen. So in cleaning the patient's chest to abdomen, we will maintain the privacy by holding the blanket upward and then start tapping the patient's chest and abdomen. After we did the procedure, we will put the blanket back for the patient's privacy. So next, we will now proceed to the patient's leg. So we will just expose the leg that we are going to clean, and then put again a rubber sheet or the rubber towel under the patient's leg. Okay, and then wet again the towel. After wetting the towel, we will make again the proper hand towel procedure. Okay, and then tap again the patient's legs with the wet towel and the under the patient's leg. After that, yung talampakan naman po ng patient is ibababad po sa water na may soap. Okay. After po noon, we will get again a clean, dry towel para naman po matuyo yung paa ng patient by tapping it lang po. Okay. After that is we will now remove the rubber sheet. Makalisin lang po natin yung rubber sheet. And then, put the blanket again for the patient's privacy. And then, you can now place the patient into comfortable position. And then, I will remove my gloves. Perform again a hand hygiene. And then, document all the procedure that you do into the patient. So next, ma'am, we will proceed to the shampooing of your hair. First, ma'am, I will perform my hand hygiene and put on my gloves on. The next one. Okay. After we put our gloves, we will now put the rubber sheet under the patient's head. Ma'am, lagyan lang po natin yung rubber sheet para maiwasan po yung pagtulo sa inyong punan. And then, put another towel in the patient's neck to support the patient's neck. Ma'am, ayusin ko lang po yung sa baba ng inyong neck or leeg. And then next is to put a towel in the patient's eyes. And then we will start in the procedure. So I have here water and a tabo. So, before we start pala is, we will comb the patient's hair po. Gently lang. Okay, after we comb the patient's hair, pwede na tayo mag-proceed in wetting the patient's hair. So, yan. Meron din po pala tayong drainage bottle or drainage container sa baba ng bed para po yung mga tumutulong water is diretso na sa lalagyanan. And then, after we wet the patient's hair, we will now put a shampoo to the patient's hair. After we put shampoo in the patient's hair, we will gently massage the patient's scalp. And then, after we gently massage, we will get a water again, and then dry the patient's hair or rinse the shampoo in the patient's hair. Okay. After that is, we will get a dry towel to dry the patient's hair. Lagyan lang po natin yung dry towel sa buhok nyo para po matuyo nito. Okay. After we put this, we will now remove the towel in the patient's eyes and also the towel in the patient's neck. And then continuously tap the patient's hair para po matuyo ito. After matuyo nito po is pwede na po natin alisin yung towel and also the rubber towel. And then next po is pwede na natin suklayan style yung buhok ng patient. Gently lang po ulit. Okay. And then next is to put the patients in a comfortable position. Ma'am, nalagay ko lang po ulit kayo sa comfortable position. Okay ma'am, thank you. And then I will remove my gloves and perform a hand hygiene again. After that is document all the procedures na ginawa niyo po throughout the shampooing of the patient. So, we will now proceed to the next procedure, which is the oral care for conscious patient. So, first is gather all the equipment, and then I will perform my hand hygiene. And I will put on my gloves. Okay, after I did my my hand hygiene, I will now put a towel in the conscious patient's chest. And I will also position the client in a sitting position. And then, I will put a toothpaste in the toothbrush, of course. And I will now start with the oral care in the conscious patient by, ma'am, start na po natin yung pag-toothbrush, ha? Yan po. Let's start in the front to back procedure in the brushing. In the lower teeth, front to back. And the upper teeth, front to back also. And to the tongue, your tongue. And next, lastly, is the front teeth. Front teeth, from the gums to the crown, up and down. Thank you. And after this is, we will get a glass of water and also a lalagyan po ng pinagmumugan ng ating patient. And ask the client to mumug po yung pinagtubasyan niya. Okay na po meron. Okay. And then, after that is, we will use the towel to touch the corner of the towel to touch the patient's mouth. So after we dry the patient's mouth, we will now use a floss to floss the patient's middle teeth. Open po. And then the down teeth. Okay, ma'am. After we floss it, we will bigyan ulit natin ng water yung patient para makapagmumog and maalis yung mga debris sa kanyang ngipin. Wait lang, ma'am. Okay, ma'am, thank you. And then after we did this, we will now again touch to the under corner of the neck towel. Okay. Tap the mouth and then remove the neck towel. And then apply a petroleum jelly or a lip balm to the patient's lips or mouth. Okay. After that is, you need to position the patient into the comfortable position again, for position of the patient. Thank you. And then after that is, I will remove my gloves and then perform the hand hygiene again. And after that, I will remove my gloves, perform my hand hygiene, and document all the procedure na ginawa po namin or natin sa patient. So, our next procedure is the back massage. So, in starting this procedure, we will of course identify the doctor's order if kailangan ba ng patient ng back massage. So, yon, identify the patient, and I will perform my hand hygiene. And then ask the client or the patient kung ano yung mas prefer niyong gamitin sa pag-back massage. Ma'am, ask ko lang po kung ano yung mas gusto niyo. Meron po kasi tayo ditong powder or lotion. Ano po yung mas gusto niyo, ma'am?
Powder.
Okay? So, when the clients already choose kung ano yung mas gusto or mas prefer nila, yun yung gagamitin. So, yung client or patient natin ngayon, mas gusto niya yung powder. So, powder yung gagamitin natin sa pag-back massage sa kanya. Okay, ma'am? Ask ko lang po, pwede po kayong tumalikod para po ma-massage natin yung likod niyo. Okay? Talikod na po kayo, ma'am. Help the client to have a privacy. Ma'am, talikod po. Yan. Talikod po, ma'am. Sige pa po. Yan. And then, provide a exposure to the client's back. And then, after we did that, we can now get a powder in our hands and start doing the massage to the patient. We will first do the entourage long massage. And then the massage the pelvic near the pelvic bone of the client. Okay, massage the client 15 to 30 minutes until the client is already feeling well. Okay. Let's assume that the client is already done in the back massage. So, we will reposition the client into supine position. Ma'am, gabal ko lang po kayo sa pagkaharap niyo, ma'am, okay? 1, 2, 3, ma'am. And then, after you reposition the client into comfortable position again, you will perform hand hygiene again. And then document all the procedures na ginawa nyo sa patient nyo. Good morning, sir. I'm Matthew Jacob Sebastian, your student nurse for the day. So first, I will just verify your medical record and the nursing care plan, and also your condition, sir. Okay naman po ba yung condition niyo right now?
Yes.
Okay, sir. Chinek ko lang po yung condition nyo para ma-check lang po mamaya if may makaka-apekto sa pag-position and paggalaw niyo, sir. So, may I know your name, sir?
Jesly Santos.
Okay, thank you. Your birthday, sir?
October 24.
Your age?
13 years old.
Okay, sir, thank you. So, our procedure today is I will just transfer you from this bed into this wheelchair, and also I have here the transferring belt so we can finish the procedure later. And also I will just close these curtains and the doors. I will just close the doors so that you can have privacy. And next, sir, can I ask if okay lang po bang mag-wash ako ng hands para po and I will perform my hand hygiene para lang po ma-prevent tayo yung pagkalat ng microorganisms?
Yes.
Okay, sir, thank you. So our next step is to put the wheelchair parallel to the bedside and also closer to the bedside. And then next, close the close or lock the wheelchair's rollers. And the next naman po is this one. And then hold the patient's neck and his feet. And then ask the patient to stand when I count 1, 2, 3, sir. Tayo po tayo, okay, sir? 1, 2, 3, up. Okay, sir. Give your butt cup po. Yan. Okay, sir, thank you. Next is to put the patient's footwear. And then, ask ko lang po, sir, if nung pagkatayo niyo po ba, may na-feel po ba kayong pagkahilo or pagka-dizziness or something panibago sa inyong feelings, sir?
No.
Okay, sir, thank you. Next is, I will put this, sir, so that we can move in transferring you from the bed to the wheelchair. This is a transferring belt, sir. Okay, sir. Bibilang din po ulit ako ng 1, 2, 3, sir. Pag sinabi kong, ay pagka 3, sir, stand up po tayo, okay, sir? And hawakan niyo po yung, iput niyo po yung hands niyo sa aking shoulder. And then pag sabi ko na 3, sir, stand up, okay, sir? 1, 2, 3, stand, sir. Now, sir, I will put a blanket above your knee for your privacy, sir. And then, you can put your feet, yung paa niyo, sir, sa tapakan para mas madali lang po kayong at hindi kayo mahirapan, sir. And then, I will remove the belt. Thank you, sir. And then, that's all for the transferring the patient from bed to wheelchair. And then, I will now document the whole procedure that have been made. Okay, for our next procedure, we will transfer the patient from the wheelchair to the bed. I will just remove this. And then, sir, we will just repeat the countings. When I say 3, we will stand, sir, and so that I can transfer you to the bed. Okay, sir. Put your hands in my shoulders, sir. Okay, 1, 2, 3, up. Okay, sir, thank you. I will now remove your slippers. Okay, sir, thank you. And then I will just remove this. And then, sir, I will just lower your bed so you can feel comfortable. And then this one, sir, when I count 3, you will higa. Higa po kayo, sir. 1, 2, 3. Okay, sir, thank you. I will now put blanket for your privacy, sir. Okay, sir, thank you.